Alzheimer's, the misdiagnosed disease. Can you recall a time that you were visiting with an elderly grandparent, aunt, uncle, or family friend to find that they would either repeat the same story or ask the same question during that encounter? If so, short-term memory loss is one of many symptoms relating to Alzheimer's disease. According to the Alzheimer's Foundation of America, Alzheimer's disease is a progressive degenerative disorder that attacks the brain's nerve cells, resulting in memory loss, thinking and language skills, and behavioral changes. This disease is the most common cause of dementia among people aged 65 and older. I have heard about dementia and Alzheimer's, but never had first-hand experience until a close family member was afflicted by the disease, and during employment at a facility that provided personal care assistance to elderly residents. As we age, it is normal to forget simple things such as misplacing car keys, what you had for dinner 2 days ago, or the person's name from an encounter at a social gathering. However, AFA lists the warning signs to more than just memory loss. It also includes confusion about time and place, struggling to maintain personal hygiene, unable to make complete sentences, making poor decisions, changes in mood and personality, as well as difficulty handling complex mental tasks that involve numbers. Dementia, which is caused by Alzheimer's, has more severe symptoms such as the inability to speak or write, to chew, swallow, or walk, to recognize familiar people or objects, to perceive internal information such as a full bladder or chest pain, depression, hallucinations, and delusions. My first encounter was my grandmother, Graham. She exhibited the majority of the classic symptoms for Alzheimer's. I can recall her repeating stories or asking questions within moments of communicating the information or receiving a response. I didn't get to see her often, so I had patience with my grandmother whenever her short-term memory failed her, and she repeated the information as if it was the first time she mentioned it. After the death of my grandfather, my aunt was her sole caregiver and experienced what is known as the caretaker syndrome. I later learned that this is a person who is responsible for providing 24-hour care that does not take time out for themselves. I have found that my aunt's lack of education about the illness and taking time out for her personal needs resulted in depression, anxiety, and the inability to provide quality care for herself and my grandmother. In the book, Caring for a Loved One with Alzheimer's Disease discusses the challenges of caring for an elderly parent and the challenges faced with that experience. Fortunately, as more is learned about Alzheimer's, there are a variety of resource books that can help cope with this difficult condition. My second encounter with this illness, when I was employed at an assisted living facility in November 2013. This is where I learned so much more about Alzheimer behaviorisms from one of the residents that were entrusted to my care. I will refer to him as Mr. M. During the first 5 months caring for Mr. M, he limited me to how I interacted with him, and at times would act out an aggression when being assisted for personal care or to the dining hall. During one of his fits of rage, Mr. M attempted to strike me. At that point, I didn't retreat in fear, but remained calm and firmly informed him that his actions were inappropriate. Although he was still infuriated, he withdrew his hand, then turned and walked into his room. That is when I realized that there was something going on within him mentally which was beyond his control. Thereafter, I learned to communicate with him as I would any other resident. Since he was unable to speak full sentences, I had to learn to watch his body language and facial expressions. I learned that when he was agitated, I had to leave him alone and then try again later. To prove that Alzheimer's is a misdiagnosed disease, I will share with you a time that Mr. M was injured and needed EMS to transport him to get further medical attention. The EMTs, emergency room doctor, and nurse were informed of Mr. M's illness and care needs. Although I spoke on behalf of Mr. M, each medical staff that encountered him seemed to ignore the information I provided and try to treat him as if he was mentally stable. His injury required medication that needed to be administered intravenously. When the nurse attempted to prep the area for the injection, Mr. M was combative. I offered suggestions that would help alleviate Mr. M's agitation. Instead, the nurse requested assistance from another male nurse to restrain him for the procedure. Since working with Mr. M, I have encountered other residents with less severe behaviors from this illness. By interacting with the resident's family, I have found that there are local Alzheimer's counseling groups available for the caregivers. An article written on June 15, 2015 in the Tallahassee Democrat, Old Capitol Going Purple for Alzheimer's Month, helped bring awareness to the public about the disease and informing them of preventative measures. From my experience, Alzheimer's affect people differently. Although misdiagnosed, the causes of Alzheimer's disease are still unknown. In order to provide optimal care, it's vital that the medical staff is educated on a continuous basis to stay informed on diseases like Alzheimer's. Being informed about the disease by reading books, attending workshops, and consulting healthcare physicians. Also, learn preventative measures by healthy eating, staying mentally active, and engaging in regular physical activities. Knowing and understand this disease is half the battle.